in the body, there's a couple different types of fat. And one of the major types is visceral fat. So visceral fat is not the fat that you can see or feel under your skin. That's subcutaneous fat. Visceral fat is much deeper within and it lines your organs. Visceral fat is particularly dangerous because large amounts of visceral fat can begin to act as an endocrine molecule. That means it can release hormones and other chemicals and messengers, and it's not just a fat storage. So, one of the simplest ways to measure visceral fat is waist size, specifically, because that's related to abdominal fat, and that's where most of the visceral fat in the body is held, would be kind of in or around the central cavity. And an increase in every 2 inches of waist size has a 10% increase of cardiovascular disease in healthy non-smoking women. And an ab fat group in another study had 3 times higher dementia risk, the group with the highest band of ab fat. And dementia risk was not associated with thigh size. So what that sort of indicates is that where the fat is held on your body, even if you have the same total body fat percentage, can matter in terms of your overall health. Visceral fat percentages and amount can also affect breast and colorectal cancer risk. So, visceral fat is not very healthy. What can you do? So the first major thing, there's no way to cheat it with visceral fat. You can't liposuction it. You can't get it removed like that because it's deep. It lies behind the abdominal muscles, and it's, like I said, it's around the organs themselves. Generally, you're gonna have to burn fat as the way the body burns fat, which would be excess caloric expenditure and less caloric intake. So that would be things like exercise and eating healthier, which is something that pretty much everyone knows. However, very interestingly, visceral fat in particular is affected a lot by sleep. In a study by Covassin et al., which means and associates, they created a sleep restricted group and a sleep control group. And so the restricted group, it was somewhat extreme. They were restricted to about 4 hours of sleep per night. The control group was allowed 8 to 9 hours of sleep per night. And abdominal fat increased in the sleep restricted group in as little as 21 days. There was a statistically significant difference in the amount of abdominal fat compared to the control group in as little as 21 days. So, your sleep does really matter. Additionally, smoking matters quite a lot. In a study by Kim et al., they found a correlation between smoking and abdominal obesity and visceral fatness. And this was even adjusted for age, alcohol, and physical activity. Smoking is not an effective weight loss method. A lot of people think it can be because it can act as an appetite suppressant. However, what the effects of smoking seem to show is that it will actually move or influence where the fat in the body is stored. So even if you're eating less because you're smoking and you have less appetite, in order to try to be skinny, which is what a lot of people use smoking for, as it turns out, your body will hold on to less fat if you're eating less, yes, but it will actually store it in a place that's substantially more damaging. It would be better for you to have more subcutaneous fat, that's the under the skin fat, on other parts of the body than it is to have more visceral fat. And smoking influences where the body stores fat towards the side of visceral fat. So it's really not helpful. So smoking is not an effective weight loss method in terms of trying to reduce visceral fat. And it also has other health damage, obviously. And your sleep is critically important. Exercise, eat well, make sure you're getting enough sleep, and cutting out the smoking will do quite a lot for increasing your overall health and reducing the amount of visceral fat you have in your body. Final note, there is some amount of fat that's necessary for your body to function correctly. When people get particularly low, sub 5 to 8% body fat, especially sub 5, you start to get into risks where there's supposed to be a little bit of fat around the organs to kind of protect them as so that they don't like bounce into each other. You know, it's kind of like a cushion. But that only is really a concern at extremes. It is worth noting, though, that not all fat in the body is bad. People tend to have this idea that the goal is just to get rid of all of the fat that you could possibly have, and that's not entirely true. There's a healthy amount you can have, but for the average person, and particularly the average American, now is often struggling with having too much abdominal fat. And so getting rid of the abdominal fat will increase your health overall. I hope that this helps. This is Pro Gain Knowledge. I'll see you all later.